So, you draw a single line through the error, you write error above the mistake, you date it, i-date mo siya kung saan mo siya naobrang error, and you initial that one. So, amo ni imo initial. Okay. Kung sa paper-based writing, pero kung electronic writing man, pero kung i-pass mo na siya, so this is how, for example, i-file na siya sa chart, pero nagsala ikaw, no, may nasalaan ikaw before mo siya i-pass sa chart, but na-print mo na siya, so amo ni ubrahon mo kung may error. Okay? Kaya we don't actually tolerate tampering. Okay? So wala natin ginabutangan sa correction fluid or gina-erase natin kung nagamit ka man sang ballpen nga erase or ano na. No? So on a paper-based na documentation. Okay? Okay, and of course, referring to yourself, no? So this is the correct way. So, okay, di ba, in documentation, we would refer it to patient. So we don't actually write I, no? So the correct way, patient transferred wheelchair to plinth with minimum assist to compensate for balance issue. So hindi siya nga, I help this patient transfer. So it's always a third person, no? So patient transferred wheelchair. So that. Okay, when we refer no to ourselves, no? So it's always the patient who na gina-refer ta. And avoid spaces, blanks, or empty lines. Why do you think so? Okay, actually, kung ara man kita gyapon sa paper-based na documentation, we need to avoid spaces or blanks or any empty lines kay para hindi siya for example, kung i-submit na siya or i-chart, punta na sa chart, hindi pwede nga ma-add ka lang daya. No, nga do out of the blue, ay nalipatan ko ni, so ma-add ako yan dira sa dalom, sang ROM, sang ammonia mo na. So hindi na siya pwede. So what we do actually, we instruct students to write, let's say, bidiri ang dako nga space. So dapat butangan mo the word nga space. Okay, meaning you are not allowed to write anything here. Okay, pwede mo na actually no ma-falsify ang document. Okay, ang mana siya siguro kung sa electronic na documentation. So, lesser lang did ang spaces. Okay. Sorry. Writing orders in a chart. So, for example, no, kung refer ka, no, or you need to write in a chart mismo, no, some doctor's order, no, under doctor's order. So, this is how you need, no, to signify yourself. No? So, date, time, order, verbal orders, physician's name, therapist/therapy signature, kung OTR ka or PT. Okay. Kung masulat ka na ni sa chart ha, and then how do you paano mo i-sign no ni ikaw nagsulat sang chart. So kinahanglan sang physician's name. Verbal orders by doctor amuni. Okay. Ara siya sa Ketenbaka. Okay, so using abbreviations and medical terms. So abbreviations to minimize use. Always remember, minimize lang ang use of abbreviations and use only universally accepted abbreviations. So hindi ka na mag-ubra-ubra sa imong abbreviation na ikaw lang kayong shinti. Okay, unless kung mayroon ka own clinic mo and then pag gusto ka kung anong abbreviation gamiton ninyo sa inyong clinic. And familiarize yourself with facilities approved abbreviation. So every facility, no, kung diin ka man na-assign, malay mo sa COLEMED, they have a different na documentation format. So you need to follow that. Okay, so ibutang talang sa table nato na we don't actually have a single lang accepted format, no, for nga documentation format. Every other facility, they have their own format. And in our school, this is our format. Okay? Pwede na siya ma-modify, pwede na siya ma-revise, no? Depende kung sa diin ka nga facility or iban, they already have their electronic health records, no? May ara sila yung own nila yung documentation na format na. Okay? Or iban ganit checklist lang na, check lang. Okay? So, kung mag-practice ka na, familiarize yourself with the facilities approved abbreviations and also their format man. Okay, na. So for the medical terminology, most medical terms have Latin-based prefixes, suffixes, or use. So, familiar na kamo sini, no, sa mga medical terms, kay very exposed na kamo to different ng mga medical terminologies. Diba? You actually use medical terminologies to patients, gani. So, amo na. So, refer to medical encyclopedia, dictionary when in doubt. Siguro kung sa mga diagnosis lang, no, kung tama gid siya ka unfamiliar sa inyo, then you can look up no into dictionary, no, or any other words na medyo wala niyo pa na-encounter. So, refer lang kamo. So, for example, no, so this is a review only, no, medical terminology. Tumor of the bone. So, ano mga term for that? No, abnormally low blood sugar, beneath the skin, above the symphysis pubis, pertaining to the back of the body, toward the head, abnormal redness, between the ribs, front of the body, conducting toward the structure. So, so ano ni sila na minya? So, ano mga terms? So, ano ni? Okay, so review nyo lang na. But as you go along, no, through your internship, you will be encountering a lot of medical terms. Okay? For using abbreviations, so for example, so mga typical examples lang that you can find in our Kettenbach na book. No? Actually, damo-damo pa dito examples. No? You can practice them. Okay? So in physician's notes, you may find the following. Patient has history of hypertension, arteriosclerotic heart disease, congestive heart failure, myocardial infarction in 2005, transient ischemic attack in 2006. So, siya, usually ang makita sa notes, no, or sa medical records, and this is how it is translated. Okay? Mani. So, you will see the different abbreviations in the book. Para siya, may mga list dito, complete list yun of the abbreviations. Okay? So, for example, no, Ari, okay, nag-input ako lang ng mga example. Okay, so how do you translate this one? And so, let's say the diagnosis, rheumatoid arthritis, rule out systemic lupus erythematosus, sakto. Okay, rule out na. Kung Ari naman, in the PT note, complaints of CO, ang SOP, shortness of breath, ang P, nga may bar sa babaw, bar dili siya dapat, after, bilateral, upper extremity, proprioceptive neuromuscular facilitation exercises. Ang mani usually ang sa mga PT note. Okay, as well, Ari, no? So, kung i-translate mo ni siya, no, into abbreviations, using abbreviations, patient ambulated in parallel bars, full weight bearing, left lower E, approximately 20 feet twice, no, with minimal assistance, no, of one person, no, for balance. So, magamit sang abbreviations. Okay, so lapit na. Okay, so different types of notes. So, there are actually different 4 types. Basic types of medical record documentation. Okay, so we have the initial evaluation, which is the main content of this course, and also you will be taught how to write other notes as well, session notes, progress notes, and the discharge summary or the discharge notes. Okay, so for the IE, written by the physical therapist, documentation of the initial evaluation is required at the onset of an episode of PT care. So the first session of the patient, that is the initial evaluation. And the succeeding sessions, those are your session notes, no, PT notes mo na. Every 3 sessions, we make progress notes. Okay, and if ma-discharge na ang patient, we make a discharge note. Okay, and then kung may i-refer sa imong mga patient by another PT, that's the time we masulat ka sang endorsement note, no? May endorsement note ikaw. Kag kung the time na ma-receive ka na sa patient from another PT, that's a receiving note. Okay, kung may napatay nga patient, expiration note, no? Ano pa na da? So those different types of notes, no, aside from the initial evaluation. So the initial evaluation should be a comprehensive report incorporating clinical findings, review of history and medical conditions, assessment or evaluation of the findings and goals, and plan of care. Okay, so let's proceed to the documentation format. So I have already presented man to you the documentation format, right? Okay, so the SOAP note, highly structured siyang documentation format. So as you can see earlier, nakita nyo naman kanina kung ano siya ka, highly structured. Okay, so it was developed by Dr. Lawrence no, as part of the problem-oriented medical record. Pero as far as I know, ang POMR, wala na siya gawa ginagamit ng subong. So the SOAP format requires practitioner to enter information in the order of the acronym's initials, no? SOAP, Subjective Objective Assessment Plan. And in every part of this, the APTA recommends no following strategies for therapists to integrate evidence-based practice in clinical documentation. So you're documenting tests and measures that are valid